Joining today. My name is Nessa Becerra. I am a BI consultant and I've also been leading the development on CReST for this past year. And I've also got my colleague here, Jen, who's going to quickly introduce herself.
Hi everyone, my name's Jen Logan. I'm a mental health program manager working alongside Nessa on the CReST program.
Thank you. So just a quick overview of what we'll be covering today. So we will be covering a few things around CReST, so the benefits of demand and capacity modelling, an introduction to CReST, a reflection of the accomplishments over the past year, we also like to learn about the current users of CReST, and there's a chance for questions. So we'll move on to the next slide. And just to start with, we would like to understand our audience today a little bit better. So we have prepared a Menti, which I will hopefully transfer to. There we go. So if you just go to www.menti.com and then input the code 22122216701, and you can do that either on your phone or on your laptop, whichever you prefer. So I'll just pause on this screen just for a moment to give everyone a chance to join. Okay, I'm just going to move on to the next slide, but if you need the code, it's still at the top. So it's just at the top of the screen here. So the first question is, which part of the system are you from? So for example, we're asking for your name, your job title, and your organisation. So if I was to answer this, I'd say my name is Nessa Becerra. I am a BI consultant and I work in transformation at SCW CSU. So this really helps us understand who we're presenting to and sort of gauge our engagement across the wider system. So it's really beneficial for us. So thank you to those that have filled this in. I'll just wait a couple more moments. Okay, and I'll move to the next slide. So it's only 2 questions, so this is the last one on the Menti. And it's just asking, what are you hoping to learn today? So what are you hoping to get from today's presentation? Are you wanting to learn more about CReST or anything in particular? So I can see some things coming up. So around how demand and capacity is used, what the tool is, how you would go about using it, which is all great and really valid questions, and hopefully things that we will either cover or will provide resources, and we'll mention the resources where you can learn the specifics of how to use it to its full capacity. Fantastic. I'll just pause for just a couple more moments before finishing up on this, and then we'll go into the presentation where we can hopefully answer some of those questions and provide the information that you're all looking for. But thank you all for completing that. It's really helpful for us. So I'm going to switch back to the presentation now. And we're going to move on to demand and capacity. So why is this important? And Jen's going to talk us through.
Thanks, Nessa. So why is demand and capacity important? There's a whole NHSE website, and we're happy to pop the link in the chat actually if that would be useful, that describes the importance and the value and actually understanding your demand and capacity and your flow, as well as how that actually impacts on patient experience, patient treatment and the pathway in their entirety. So I won't read this quote verbatim, but we thought it was a useful kind of scene setter and kind of supports the narrative that we'll be discussing today. Could you put the next slide, please, Nessa? Thank you. So demand and capacity can help with several different areas, and some of these are on the slide in front of you. There's many models that can look at demand and capacity. SCW as an organisation have been involved, and kind of we've got some experts in demand and capacity and modelling and tool development, etc. But again, on the NHSE website, there's lots of tools that are available, and that they kind of signpost you to. Some are quite complicated, some are a bit more simplistic, but again, it depends on the pathway that you're looking at, or again, that kind of the data that you're inputting into the tool also. So demand and capacity can help you answer some particular questions. It can support pathways that are established. It can support kind of thinking about new pathway development, sorry. And they can increase the understanding for all colleagues. So it can create that shared language between commissioners, performance, analytic colleagues, as well as operational managers as well. I think for me, the really kind of powerful thing about demand and capacity when it's kind of done right and when you've got the data to go into it is it enables you to compare apples with apples. So rather than looking at apples and pears as well, again, it really supports that shared language and that shared understanding of what is our data actually telling us. Next slide, please, Nessa. So a bit of background into CReST and how it can help. We've been working as an organisation, so SCW, in partnership with NHS England for several years now. And as you'll see, there's been different iterations of the tool. In March 2020, so just as the pandemic kind of hit and we went into lockdowns, we released the previous iteration of the tool to support colleagues thinking about their demand and capacity and their flow and kind of the impact of the pandemic and lockdowns having on pathways and waiting lists. Since April last year, so in the last 12 months, we've really kind of driven CReST forward. So again, working in partnership with NHS England, we've done a lot more development this year, which Nessa will be talking us through shortly. And alongside that, we've had a lot of kind of standalone projects within the overall programme. So thinking about how do we better engage with our users? How do we better market the tool? How do we optimise the tool in terms of people's understanding? And again, it kind of links back to what we were describing at the beginning. So really trying to support colleagues with understanding the value of demand and capacity. Thanks, Nessa. So we've got a quick animation, and this is one of the things that the team have developed this year. And again, happy to pop this in the chat, and it's easy to circulate as well. So hopefully this will work with the sound. I'll just put myself on mute.
The imbalance between demand and capacity is one of the core reasons healthcare backlogs and waiting lists grow. At times, patient demand for a service can fluctuate and may surpass capacity required to deliver a service, for example, during winter or when schools return after the summer break. Having greater understanding of the outputs of demand and capacity modelling is essential for the planning and delivery of today's healthcare services. So how would a service better plan for variation in demand? CReST, the Children and Young People Mental Health Referral System Management Tool is an accessible and user-friendly demand and capacity modelling tool. It allows for an evidence-based approach to strategic and operational planning and can answer questions such as: how can I manage reduced capacity in my workforce because of absence and sickness? What does my demand look like over the next 12 months? How can I manage an influx of demand? What is the optimum number of inpatient beds or appointments required for my demand? When modelling with CReST, users can model and create scenarios for services and pathways simultaneously by uploading their service data using the template provided, deliver customisable management reports including charts and data tables, and model a 12-month forward view considering potential emerging backlog. Outputs from CReST provide valuable insights that allow service leads to discuss and reach decisions around service planning and provision, managing backlogs and reduce capacity. To learn more about CReST, visit our website or contact us for more information.
Brilliant, thank you. So this slide kind of just summarises the animation and what we heard there. But one thing I just wanted to pick up on that was mentioned in the animation is CReST is obviously for children and young people's mental health pathways. However, it can be used for inpatient modelling as well as community-based modelling, just based on the mathematics behind it as well. So it's quite an accessible tool in different pathways. I'm just going to hand it over back to Nessa now.
Thanks, Jen. So I'm just going to talk through some of the steps of development for the past year. So we start with the steps that we took for the tool development. So in April 2022, as we've mentioned, SCW were commissioned to actually increase the functionality of the CReST tool. And that was to ensure that it aligned with national priorities, so specifically in support of the ICSs and their service planning. And part of that is recognising the need to batch upload all of their CYP mental health services at once instead of inputting figures one at a time for every single service, which would be quite time consuming. We completed this in a number of steps, as you can see. So the first step was the step of procurement. So we provided a proof of concept. We were procuring the infrastructure that we needed and making sure that really we set a foundation for success going forward. And then we went into the development stages. So phase one included launching the provision for users to upload data based from a CSV template. So instead of having to input, they could populate it from a CSV file. And as part of that, they could upload multiple services at once. There's also the inclusion of a 12-month forward model. So that would take into account seasonality, which is, very important, especially when you're looking at CYP services, and allow users to start considering sort of emerging backlogs. Before launching this phase and before launching every phase, we undertook user testing. We collected and reflected on their feedback and went through an iterative process before a go live. We then moved on to a phase two development. So phase two improved on the previous phase and ensured that users could download visualizations, so take away data tables to use in their own reports and their own discussions within their organisation. We also, based off user feedback, we amended the backlog calculation so that we could include a pre-existing backlog, because as much as we hope that there's no backlog that exists, realistically, most services do have a backlog to contend with at the moment. And that was our phase two development. Phase three focused on the ability for users to start saving their scenarios. So if you're going through a what if scenario and testing different events and different changes to the service, we now have a functionality where you could save that, test a different version, and then go back. So you can switch backwards and forwards. And part of that means that we can pass those events, those scenarios that you've saved, and create a personalized management report. So that's either a PDF or a PowerPoint. So you can again take those away. And that's something that we found out that a lot of users were doing manually. So we're just trying to restrict that. And then finally, we moved into maintenance. So maintenance didn't mean a stop of developments at all. It just meant that it was slightly smaller development. So based off user feedback, there were some tweaks for accessibility, some tweaks just to make it as user-friendly as possible. And that's the stage that we're currently in, where we're maintaining the tool and just making slight improvements to make sure that everyone gets the best version of CReST and the easiest access to their data. And then there's a part on promotion of CReST, which I think Jen's going to talk to.
Yep, so really quickly, just to give a quick summary. So as I mentioned, there was a kind of standalone marketing and communications plan over the last 12 months. So this included us presenting at various different forums and meetings, either in person or virtually, regular newsletters, so quarterly newsletters, blogs, the animation obviously that you've seen, as well as thinking about the website and how user-friendly the website is based on that feedback. So Nessa's just going to give a quick summary around the latter.
Get to the next slide. Yeah, so as Jen just mentioned, we undertook a website refresh this year, and that was based off, again, user feedback, and went through a process of testing, improving the content, so improving user guides, improving the video tutorials, doing a refresh, but testing it with our actual users and gaining feedback on what they felt would be most appropriate. And then now those changes are live. So we have an example of the previous version and what it now currently looks like when you go to the CReST website. And then finally, just to mention that something we're particularly proud of is our win in the area of innovation in mental health for the Health Business Awards. And that's something that we achieved this year in recognition of the developments over the past year. Jen, I think you're going to be talking through our users.
Lovely, thank you. So we currently report on our users on a monthly basis to NHS England, and this slide gives a flavour around where the users are and obviously kind of the active users. So we also report on new user registration, but also active users. So that's data that we're able to pull, which can be really insightful, actually. So we noticed, for example, an uptick in September after the development went live towards the end of August as well. One thing just to flag as well is the SCW support behind it. So we've obviously got kind of a variety of team members with different skill sets, and we all come from different service lines, so kind of different directorates, as it were, for those of you external to SCW. So we've really kind of pulled together as an MDT collective to deliver on CReST, but also to make sure that the right skills are in the right place for this. So, for example, we've got colleagues, a team who man the CReST inbox. So they've had 74 mailbox support requests, and in total, the team have provided over 2,000 hours of support. So we're really proud about kind of how we've all come together, and we've worked together as well to kind of deliver CReST, and as Nessa mentioned, to be able for that to be recognised with an award. Next slide, please, Nessa. Thank you. So we actively have been trying to get user feedback this year. So that's come in various forms. So whether that's a feedback form, for example, or via email, or us making sure that we're able to close the gap. So for example, if someone's contacted us for some modelling support, for example, or challenges with inputting data or some understanding about interpreting the results, we try to capture that feedback because it's really valuable learning for us and to make sure that the tool is really meeting the needs of users. So we've got a couple of examples of user feedback there, but it's something that we're constantly thinking about. Next slide, please, Nessa. I won't play this one just in the interest of time, mindful we've only got 10 minutes and we want some time for questions. But again, what we can do is pop a link in the chat. So this is a video testimonial for a colleague from Oxford Health Foundation Trust who's used the tool. So it's a really nice example, actually, about someone who's used the tool in real life rather than just us sat here talking about it. So we'll make sure that this is circulated also. Next slide, thanks, Nessa. So just a couple of bits in terms of more information. So everyone is able to register for CReST. So if you are interested, all you need to do is just register. It's free, so it is available. What's also good about CReST as well is something that we haven't mentioned is thinking about the use of CReST within ICSs and thinking about the different partnerships in ICSs now. So we've got local authority colleagues, for example, who have used it, and we've done demos and supported voluntary community sector colleagues with modelling and accessing the tool as well, which is great. One other thing that we've been really keen to do this year, and that's been delivered also, is user guides and video tutorials. So we've got kind of the written one because we're very aware that everyone learns and kind of needs information in different ways, as well as supplementary video testimonials of how to use the tool as well. So they're all broken down into sections on the website also. But we do have the email address there as well, so feel free to kind of touch base if you've got any feedback or any queries or any questions. We are working in partnership again with NHS England from April, so from next week for the next 12 months. The programme will look slightly different, so it's less looking at development and marketing and more around that kind of maintenance because of all of the work that's gone into CReST this year as well. But really exciting that we're still able to work in that partnership and CReST is still able to meet the needs of their users. Brilliant. I think the next slide is any questions. So I think any questions for Nessa or myself, obviously pop your hand up or in the chat. Very quick whiz through of CReST. I've seen a few links come through as well, so that's really helpful. Thank you, Ren and Vanessa. No questions? Wonderful. I'd really encourage everyone to go and have a look at the tool, even if it's just for a little nose, to be honest, because it really is great. But do you
Jen,
feel...
there is a question in the chat, some about something's coming in front of it. Do you have any users in Bristol?
So yes, so we've got users in the southwest. I think this slide kind of demonstrated it might not have shown clearly. So I've just seen another question come in. So yes, we do. In terms of that granular detail, obviously we wouldn't, just in terms of IG and GDPR implications of saying who exactly we've got in certain areas. But yeah, we've got users all over the country, and obviously mindful that SCW, kind of in the way in which we work, we've been really mindful of making sure that CReST is promoted across the country. But yes, we absolutely do have users in Bristol. But feel free to spread the word. Obviously, if the animation link's in the chat, more than happy for that to be circulated wide and far as well. Charlie, please may you post the link in the tool. Yep, absolutely. We can pop the website in the chat bar as well. Not a problem. I'm sure someone can do that in the background, but if not, I can pop that in shortly. Any final questions or thoughts or reflections? Nessa, are there any final thoughts from your side?
No, none for me, just to really emphasize, like, give it a go. There's also the support team there to offer guidance, but there's so many user guides that really break it down step by step. And we'll share the slides if desired, and we have all the resources that we'll share links to after this.
Yeah, absolutely. And Vanessa, just to your point, the video that we missed, so the testimonial, it's about a 5-minute video, so that's why we weren't too sure about playing that one today, but it will be going up on the website as well, so it will be completely accessible and able to be shared as well. Brilliant. Thanks, Ren. Thanks, Maham. Wonderful. If there's no other questions, do feel free to kind of shout either directly to Nessa or I, or obviously to the CReST team. But thank you all very much for joining.
Thanks, everyone.
Well, thank you. Bye.